Okay. All right. Well, I will go ahead and get started. If there's other people that want to chime in, I'll let them in. But welcome to Thursday, October the 15th, Lunch and Learn. With us today, we have Jessica DiCarlo, the unit supervisor at Harrisonburg-Rockingham Division of Rehab Services here in Harrisonburg. So I'm going to turn this over to Jessica and let her get started. You see down at the bottom of the screen, there's like a little green button that says share screen.
Yes.
So that's all you need to do if you want
to. Okay. All right, everybody. Hi. Thanks for coming on and doing the Lunch and Learn to learn more about DRS. Couple of housekeeping things. We have been having people work on the fire alarm systems all day. So if you hear them going off, I might just mute myself for a minute and take a brain break. I don't know how many of you guys have kids in school right now, but they take brain breaks all the time. So we'll just take a quick brain break if the fire alarms go off. For those of you that don't know me, my name's Jessica. I'm the DRS unit supervisor for the Harrisonburg office, which covers Harrisonburg City, Rockingham County, and Page County. We have offices all over the state. You guys probably work with our Fishersville office as well, and possibly our Winchester office, maybe. I don't know. No, probably not. But anyways, we serve individuals with disabilities who are interested in finding employment or getting ready to find employment. Right now, I guess I'll go ahead and share my screen and hope it works. Oh, where is it? Okay. Okay. Can you guys see my screen?
Yes, we can see it.
Okay, sweet. All right. So you have to forgive my PowerPoint skills. It's been a while. So like I said, we're DRS. The Division of Rehab Services falls under the umbrella for the Department for Aging and Rehab Services. I'm sure you guys are familiar with VPAS. That's kind of our Valley Program for Aging Services. That's the aging part of our department here in Harrisonburg. Let's see. So what are we? We are Virginia's federally mandated vocational rehab program. And like I said, we help people with disabilities get ready for, find, and keep jobs. We help to increase people's ability to live independently in their communities, so we can provide a very wide array of services to help people be able to get up and get to work on their own as independently as possible. And we work with individuals with every type of disability. Our services can include, but aren't limited to, vocational counseling, training, and then job placement as the ultimate goal. I'll come back to that at the end. There's on YouTube, there is this called the Vocational Rehabilitation National. Oh, it popped up. Sweet. Okay, let's see if it'll work. It's kind of like a little bit corny, but it's cute.
Can you hear it, Jessica? We can't hear it.
All right, whatever. We'll skip that. You guys can check that out if you want to. You just Google Vocational Rehabilitation National Anthem. But it just shows people working in different employment settings and kind of gives an overall idea of what we do as an agency. A lot of it is, I think, was filmed at Wilson Workforce and Rehab Center, which we'll talk about in a minute. But I'm sorry that didn't. Oh no. Oh no. Okay. So we're skipping that. So I think most people on this call are staff. So I had done this presentation for prospective consumers. So just have your consumer hat on. Could the VR program help you? Do you have a disability? Yes. Do you want to work? Yes. And are you having trouble getting or keeping a job because of your disability? So if you answered yes to any of these questions, we might be able to help you. So the vocational rehabilitation counselor, that's me. And we have Patrick Flanagan in our office who does significant mental illness. We have Darlene Cooper who gets referrals from TA and Broadway High School, as well as just general rotation. And we have Ashley Miller who gets referrals from Harrisonburg High School, East Rock, Spotswood, and then general rotation. And Andrea and I were just chatting about we're hiring for our pre-employment counselor, who I think many of you probably at least heard of, Brett Hart. He left our agency back in July and he works for DBVI now. So we're actively hiring for his position. So anyways, what's a vocational rehabilitation counselor? We are people who are experts in disability and career counseling. Our job is to meet with folks, determine what barriers they have to employment due to their disability, determine their eligibility for our services, and then work with them to develop a plan to achieve their employment goals. And that's my cool Bitmoji that I just learned how to make at the bottom. Okay, so if you have a consumer or yourself, you needed to be involved with DRS, this is kind of the process. You could call in and refer yourself, or a community partner could make a referral for you. Then we would schedule a time to do an intake. So right now, because of COVID, we are giving people the option of doing that virtually over like Google Meets or Zoom, but usually Google Meets because that's more accessible for people for some reason. Or we can schedule a time to do it in the office as long as people agree to wear their mask and can pass the health screening questions. So then you come in, the counselor speaks with you about what challenges you're experiencing because of your disability, gets to know you, and then we would, well, I'm going to go through this, but you'll see this. That's our phone number. Talked about the process for COVID. I'm getting ahead of myself. I get nervous on these Zoom meetings. All right, so you come in for your intake, your first appointment. It's probably very similar to y'all's intake process. Talk about your disability, what your job goals are, what other community partners you work with, and or who your doctors are, because part of determining eligibility for our program is getting medical records, because we actually have to have a documented disability. So names and addresses of schools you've attended. So for that, we would be looking at IEPs and any psychological or social evaluations that went along with those. Places you've worked. So what's your job history or your work history, and why didn't it work out, or why are you trying to switch? Those are our conversation starters. Transportation issues. And if somebody does not have this information readily available, we would work with them to request it, and we can dig in and do the research about where they went or who we need to contact. Services, if you're a U.S. citizen or a non-U.S. citizen who has provided documentation of legal eligibility to work in the U.S. You have a disability that constitutes or results in a substantial barrier to employment. So that's important right there to think about. Just because I might have ADHD doesn't mean that that constitutes a substantial barrier to employment. So people don't automatically qualify for our services just because they have a diagnosis. It has to be causing issues with securing or maintaining work independently. You have to live, work, or go to school in Virginia, and your DRS counselor has to determine that you require our services. So going back to, it's not just the diagnosis, it's that you need us in order to achieve your employment goals. All right, so when we get those medical records, we're looking at functional limitations. So we're looking at how your disability impacts you in these areas. So mobility can be getting around in the community. Self-direction is being motivated, staying on task. Self-care is, can you do all your ADLs? Can you budget your money? Can you take your medication? Interpersonal skills, do you isolate? Do you fight with your peers a lot? Have you gotten fired for, I don't know, has your disability created issues with the law? That's another one for interpersonal skills. Communication, so that can be written or oral. Work tolerance, do you need accommodations or can you not work a full 8-hour day? And then work skills, do you require additional support in order to learn a job? Additional meaning more than somebody else. So if you get so many checks on those boxes, then that kind of puts you somewhere on our priority list. So right now, DARS actually just opened up category 2. So for category 1, we were only serving individuals with 3 functional limitations. So we call that most significantly disabled. And then category 2 was 1 or 2 functional limitations, and that had been closed forever. But some good things came out of COVID. We were able to save a little bit of money, and we were able to open up those categories. So those are open now. So then we do the eligibility, we've identified the barriers, then we're getting back together with the consumer to develop the plan for employment. So for folks that are familiar with IEPs, I kind of compare this. This is our IPE, except it's not educational goals. So, progress measures to finish school. This is like goals and progress measures to get a job. So it actually kind of looks similar. So it's developed after we do the eligibility. We have the consumer, family members, service providers, and the DARS counselor. And it focuses on the goal of employment, for employment, and it plans the necessary services and funding. And it is like a working document. It can change. So when we're developing that plan and thinking about what services are going to be needed, these are the things that we're going to be talking about. So do you need modifications or accommodations in order to work? How are your communication skills? Are you organized? Do you need assistance to get from place to place? Do you need training or supervision? So that could be, vocational training, or that could be a job coach. What's your work stamina? What are your work habits? Do you need any adaptive or assistive technology? And then here's some lists: money management, medication management, self-care capability, ability to plan and initiate activities, problem solving, interactions and relationships with others, and self-advocacy. So these are things that we would all be aware the individual for employment, and then we would continue working with them while they're employed to make sure that everything stabilizes and they're feeling good and comfortable. So I know a lot of times people have questions about like us paying for college or vocational training. Yes, that is something that we can do, but that is a service that requires somebody to be financially eligible. So some of our services are provided at no cost. So that would be like your counseling and guidance, your job placement services, pre-employment services. All of those are just available to anybody that walks in the door. But when we start talking about spending money, we have to make sure that, we're not buying work boots for somebody that makes $300,000 a year, or their parents make $300,000 a year. So some services involve a financial participation from the consumer. Many of our consumers receive Social Security, either SSI or SSDI, and that automatically financially qualifies them. Okay, I feel like I'm talking fast and we're nearing the end. Okay, so I talked about some no-cost services. Counselor, Aileen Jackson-Diggs, and our employment specialist, Diana Dawson. They are fantastic. They're out and about. They work with Virginia Career Works. We're very involved in the workforce. meetings and all of that stuff. But Aileen is the one who's going and connecting with employers and setting up work experiences and internships and on-the-job training. For on-the-job training, we can actually reimburse an employer up to half of an employee's wages while they're training. So usually that's about like a 6-week period of time. So she's able to offer those incentives to employers and kind of get our folks' foot in the door. She also helps with job interviewing. I had an awesome example is I had a young lady who was interested in being a crime scene investigator. And I was like, I don't know if you really understand what's involved in that job. And Aileen actually set up an informational interview with a private investigator who then happened to have a friend who was a crime scene investigator for some, I don't know, I want to think like Orange County or something like that, and was able to like do a Zoom conference and then told her all about the job. And then afterwards she was like, I do not want to do that. That sounds tedious and that sounds horrible and I'm not that organized. So some of what Aileen does is helping rule in and rule out and helping consumers make informed decisions about what it is that they really want to do. We get that a lot with like video game design too. I'm sure you guys have heard that. But anyways, so Aileen and Diana work as a team and they're just out and about in the community getting our folks jobs. So I talked about some services that could have a cost share. So that's higher education, vocational technical training, some durable medical equipment, some AT, therapeutic interventions, driving services, and supported employment. Maybe I should talk about supported employment for a minute because I'm sure you guys hear about job coaching and job coaches. So DARS contracts with several vendors, ESOs, to provide job coaching services for our folks. So those are individuals who have the most significant disabilities. A lot of the times we start with situational assessments where the job coach is going out under the direction of the counselor and the consumer and seeking employment settings for the person to go try out so that we can see what their strengths are, what their challenges are, and if that setting is going to be a good fit. If it is a good fit, and we get a well-rounded view of what the person is really going to be successful in, then the job coach moves into job development with the consumer, where that's where they're actively interviewing and applying for jobs with the assistance of their job coach. And then placement and training, which means after the person has gotten the job, then the job coach is on site with them and helping them develop natural supports and learn their job duties and just get comfortable, learn how to clock in and out, learn their daily routine. And then the goal of supported employment services is for that job coach to fade out of the picture. Now, sometimes many of the people that you guys work with have waiver services, which kind of tie in nicely to the end of that. We do have some long-term employment support funding, but it's very limited. So yeah, that's the short version of supported employment. We get those questions a lot, and that is a cost-based service, so people have to qualify for that. I realize I don't have anything on here about Wilson Workforce and Rehab Center, WWRC. They're kind of our sister agency in Fishersville. I'm sure you guys have heard of them. And they provide some therapeutic services, but they're kind of transitioning more into focusing on vocational training that ends and results in credentialing for the people that are there, industry recognized credentials. So they have the PERT program, which is where students in high school can attend for 10 days for an assessment in some different areas. Then they have the PREP program, which is kind of like an independent living skills 9-week program. And then they have driving services, so supportive services for people to be able to get their learner's permit and their driver's license. And then they have vocational training programs. So they have I'm trying to think, information technology, logistics, CNA, healthcare, PCA, business, oh, I said business, IT, materials handling. I mean, it just goes on and on. They have all sorts of different stuff. Due to COVID, they were shut down for about 6 months. They just brought back their first cohort, which were individuals that were on campus at the time COVID shut everything down, which was in March. So they just brought back a small group, and they're thinking that any new referrals that we get, so if you guys had anybody in mind, probably wouldn't be going back until, or wouldn't be attending until spring of 2021 at the earliest. So, but they're moving, and they got people in there, which is, we're going in the right direction. Okay. Frequently asked questions. What kind of disabilities do you work with? I said earlier, all of them. We do. We work with individuals with intellectual disabilities, developmental disabilities, physical disabilities, significant mental health, trying to think, substance abuse. I'm sure I'm missing something, but all of them. So what if you have somebody that doesn't know that they have a disability? So this comes up often when we get referrals from the Workforce Center or Virginia Career Works. They'll call us up and say, well, I have a person here who can't read, or I have a person here who's having trouble seeing, or I have a person here who says that they have diabetes and it makes them miss a lot of work, but they don't have well, the person with diabetes probably has a diagnosis, but the person that can't read. If somebody doesn't know that they have a disability, we can provide testing to go ahead and get that documented and then get them eligible for our services. So really, it's a conversation. All right, can somebody be eligible if they're working? Yes, if they are significantly underemployed, or if they've received like notification, or they're getting written up, or if the job is causing them more harm than good, so like physically. If they're physically not able to do their job anymore, yes, then they can still be eligible. If I apply, will that affect my Social Security benefits? No, applying for our services does not affect Social Security. Bend out and contact with extended counseling. I believe Vail provides that service as well, so that people are making good informed decisions and know exactly what's going to happen with their Social Security benefits once they start working. So that could be, you know, if they want to maintain all of their benefits, they can only work a certain amount of numbers, or if they wanted to transition off of benefits, what does that look like, and what supports are there, what are their safety nets, and, you know, what if something went wrong. So anyways, we provide that service. Applying does not affect your Social Security benefits. Lastly, we get this a lot. Does DARS have jobs to give to people with disabilities? And the answer is no. We don't have jobs in a drawer to hand out to people. We help people find their own jobs. So we support people in their job search in all of the ways that I just described. So, like I said before, we serve Harrisonburg City, Rockingham County, and Page County. Offices are located all over the state. This is our number. If you have somebody that you would like to refer, right now you would just call the main number and tell June a little bit about the person, and then they would get referred to the correct counselor, and then the counselor would reach out to the person to schedule an intake, whichever way it needs to be done, virtually or in person. All right, that's all I have. Does anybody have any questions for me? I feel like weird talking to myself this whole time.
I know everybody always leaves their cameras off because I think most of the time people are eating lunch. So
no worries. I ate mine first.
I have a quick question.
Sure.
So are there other agencies like for Augusta County and other ones that are around Virginia?
Yeah, so the Fishersville DARS office covers Stanton City, Augusta County, Rockbridge County, Buena Vista. I want to say Lexington, but I'm not 100% sure about that.
They cover Buena Vista, they should.
Yeah, okay. Yes, the Fishersville office covers all of that area, like Verona, Weir's Cave. So you would reach out to them with a referral for somebody that lives there. And I can give you that information if you don't have it.
So we should be the ones giving the referrals, or they should contact you?
Either way, I mean, if the consumer is able to pick up the phone and call in and self-refer, then that's great. That's what we would prefer. But if you're sitting with them and you're helping facilitate that, or if they give you permission to make that referral, then that's totally acceptable as well.
And then they would do like an intake to figure out what services you all have and what would work for them.
Mm-hmm. Yeah. And then once, the counselor from whichever office it is reaches out and contacts the consumer, they would get to know them and make sure that it was a good fit, make sure that our services are what they're requiring, and then go from there. You wouldn't have to be involved in from there, your involvement would stop unless we were doing some type of collaborative effort with the DARS.
Perfect, thanks.
You're welcome. Any other questions? Is everybody pretty familiar with DARS? Or was this like all brand new information?
I think most people have like a basic overview, but have not worked directly with DARS on a regular basis. Most of the people we have on today are service facilitators or our student interns. So while they've probably heard of DARS like peripherally, they've never had to like refer anybody or sit in on any intakes or anything like that.
Okay, cool. Well, I'm glad that I was able to share this information with you. We are taking new referrals. We are open for business. COVID significantly slowed down our referrals. So if you have people to send our way, please do.
Are you guys working in the office or are you still working from home?
Primarily, we're working from home. We have like a couple days that we can come into the office and use it if we want to. I have no idea when we will be, if we will ever be fully back into the office. I mean, this is just my opinion, but it almost seems silly. Like we've proven for 7 months that we can be productive at home. So requiring people to be in the office 8:30 to 5 every day just seems a little like, I don't know how they're going to do that, but they might.
Okay, cool. Well, Jessica, thank you for taking the time to kind of hang out with us and give us an overview of DARS and what that looks like and putting a face to a name.
You're welcome.
Appreciate it.
Appreciate it.
And guys, or anybody, feel free to join us next Tuesday when we have our lovely Chelsea schooling us on how to do various budgeting skills. So also, if you guys are working with anybody at DARS that you feel could benefit from any of this, they're all free. They're on Zoom. Feel free to just send the links out to whoever you want.
Okay, I definitely will. That's a good service, especially for our budgeting. I mean, for example, it's great for our pre-ed students if I can get them to check their emails.
Yeah, some of what we have are professionals coming on like today, and then some of what we have are staff actually doing some IL skills training. We tried to do a little bit of both to catch different audiences, and some are successful.
Yeah, I'll spread the word.
Awesome. All right, well, thank you again.
Thank you. Thanks, guys. Have a great day.
Bye.
Bye.